Thessaly test. So basically, this is kind of test patients' balance also, because you can see how bad their core strength is. You have them bend, and then you have them twist side to side, not through the waist. I have so many people that can't do this. They're like this, and I'm like, no, you're not even turning your knee. So it's a compression rotation. A lot of these meniscus tests are designed to compress the tear, pull it, and you check to see if they have joint line tenderness or pain wherever you're suspecting the meniscus tear is. They're pretty accurate a lot of times for medial meniscus tears especially. So, and if your patient has some balance issues, you can like have them hold your leg. So this is a Thessaly's test. Can you advance to Thessaly's on the thing? Okay. So that's my former scribe doing it. She was really good core stability. So it's twisting in and out, not this. It's not chubby checker. Okay, we'll get to that. That's good. So you want to check mobility of the patella. Obviously, you're going to, like, if this is something that the patient doesn't have a big effusion and you're thinking they twisted their knee and they have joint line tenderness, you're thinking about meniscus tears, you can skip that test. Okay, next thing, say someone comes in, acute injury, big swollen knee, they're walking down the stairs of a jetliner and they trip and fall, and now they're having trouble, really a lot of trouble walking without crutches. You want to check for maybe a quad tendon tear or a patellar tendon tear. Bill Clinton, walking down the stairs of his airplane, tripped and fell towards quad tendon. One of the tests you can do for checking if you're suspecting a tendon rupture, big swollen knee, is you can check for tenderness. The most common place that a tendon tears off the patella is either quad tendon from the patella is up at the top, patellar tendon from the patella is just below the patella. So you want to check for that tenderness. Sometimes if you bend the knee up, you might actually feel a palpable gap between those two things. The best test for you is have the patient lock their leg out and try to do a straight leg raise. Like that. If they are unable to do that, or if they're unable to you bend their knee up a little bit and ask them to extend it straight against gravity, then based on the mechanism and the tenderness, you should get them in to see someone right away. That's something that we need to see within a few days after the injury. You could order an MRI if you can get it quickly, but if you're not able to, just refer to an orthopod based on the mechanism and this exam. A lag would be if I asked Kristen to lift her leg up as a unit and she just like have this trail. The lag is like this, and they're not able to lift it up just like that. You're doing it too well. Like this, okay? And she's never able to straighten it out. I lift her leg up like this, and she's not able to extend it without my help. And again, if you can also feel for a gap too, or where they have tenderness. So that's an acute injury, something you want to refer right away, okay? So the key with this is you're not going to be able to do a McMurray's on someone with an acute knee that's stiff, because for this to be effective, you notice, that's you in the video too, like getting tested twice at the same time. You want to flex the knee up enough. So I don't want to do this if someone shows me actively they can only bend to here, I'm not going to go like this, because then they're just going to take a swing at me probably. So one of the things that I neglected at the very beginning, well, we can do it now, is I want to see what Kristen's range of motion is. So I check her other side first, because hopefully she has a normal one. I want to check how much she hyperextends and how much she can bend up on her own. So flex your knee up. So she's very flexible. She's like 0 to 140 degrees. She doesn't hyperextend. She doesn't lack extension. If someone has a bucket handle, maybe they can only straighten out to here, and they try to straighten out more. They have pain where the meniscus is flipped in the front. But if they have an acute knee, maybe she comes in, she can only straighten out to here, and she can only bend to like there, and it's painful. So I'm not going to go and do this because she's not going to like it. So we check our motion, we compare side to side. An ACL is going to be stiff also, but they hopefully with some coaching can get fully straight. So, all right, so we've confirmed that she has decent range of motion, so now we can do a McMurray's test without her being upset with me. So I'm going to bend the knee up, and I want to flex it up enough so that I'm compressing the meniscus and torquing on it. I usually put my fingers on the joint line, and then I do a varus stress. I'm swinging the foot in kind of like a pendulum. And then I'll go out, just like in the video, to valgus stress to close down the lateral joint line. So I'm kind of checking medial meniscus, lateral meniscus. So if Kristen says it hurts over here on the joint line where we palpated before, or maybe sometimes you feel a click, that's not super common. A lot of times I just go by pain. Then that's a positive McMurray's for a medial meniscus tear. If she says when I do this that she's got pain on the lateral joint line, then I'm suspecting a lateral meniscus tear. What happens if I do this and she says she feels a pop or some discomfort on the lateral joint line? What do you think? Positive McMurray's? IT band snapping. Again, the cheater. So IT band, a lot of times it'll snap over the lateral joint line if they're tight. I'm just joking, as you can tell. I appreciate that. Other than the whispers, I like someone shouting out the answer. Okay, so it's lateral, IT band, not usually lateral collateral ligament. Okay, what about when we do the other way, valgus, and patients have discomfort on the medial side, in the middle? Positive McMurray's? MCL. So this will stress the medial collateral ligament. We'll get to the ligaments in a second. So pay attention to, think about like what you're compressing and what you're stressing. So don't just, if she says she's got medial joint line tenderness when we're doing this, it's not a medial meniscus tear. We're actually opening up that space, so she shouldn't have tenderness. So MCL. So that's McMurray.